Hello, everyone. Just wanted to welcome you. We've got a couple minutes till we will get started, but just grateful that you're here, and we'll get started in just a minute. Hello and welcome, everyone. We are so glad that you are on with us today. And we are so grateful for Mary Wachansky and Michelle Savio to be here with us from the National Center for Adoption Competent Mental Health. Oklahoma is partnering with this excellent center to do a host of things. One of those being having a good discussion of how to build cross-systems collaboration, strengthen cross-systems collaboration across our state with additional support and awareness of adoption competent mental health. So Mary, Michelle, thank you so much for being with us today. I believe you have capacity to be able to share your screen. And if there's any tech issues that come up, just let us know and we'll see how we can support. But I will turn it over to you.
Hey, thanks, Bonnie. I really appreciate that. And thanks, Michelle, for sharing your screen. We hope today we can share some information about the National Center. And we want to make this a little bit, interactive. So please feel free. We're a small group to ask questions. We'll get through, I'm sure, the slides, but we want to make sure it's meaningful to all participants. So if you have a question, feel free to ask. Okay, so as Bonnie stated, we are a national center that was funded to improve mental health outcomes in children and families who have experienced the child welfare population. So again, it's a piece of the mental health system. Again, we're focusing on those children and youth and families who've experienced the child welfare system. Okay, next slide. And it's great to see who's here. So I appreciate that. Yeah. Okay, so I'm joined by my colleague, Michelle Savio. I am the director of the initiative, and Michelle Savio is the director of technical assistance. And we are here to provide information to you today, as well as answer questions about the center. Okay, next slide. So what we want to talk about today really is, do some, and by introductions, we were thinking by chat. So if you would be kind enough to share in the chat, who you are and maybe where you work or what your role is, that would be really helpful. We're going to provide an overview of the National Center. We're going to talk a lot about adoption competence. We're going to talk about how our initiative partners with youth and families at front and center to transform systems. We'll talk a little bit about how we apply a racial and broader equity lens. And then we'll talk about, technical assistance. So our hopes really is when you walk away, that you understand really the purpose of the National Center and you understand adoption competence. And we'll broadly talk about kind of what that applies to and envision kind of what technical assistance will look like in Oklahoma, and then know about resources. So, okay, next slide. So we'll start with kind of answering the question, why was the center funded? So the center was funded in October. It is a 5-year initiative funded by the Children's Bureau. And it's a unique initiative because it is the only initiative that actually at the goal level is to go cross system from mental health to child welfare and from child welfare to mental health with the alignment of improving the outcomes, mental health outcomes. So again, it's quite unique in that it is, dual system. And also, what we're trying to do in the center is to bring forward the adoption competence understanding, as well as the investment of different states, tribes, and territories, Oklahoma being one, in terms of moving that system forward. So we really envision a world where, in the ideal situation, families have the tools that they need to reach their full potential. Mental health, we believe, is one of the foundational developmental pieces of life that actually can catapult achievement academically, socially, in families, and other things. So it's really important that we make sure that these families and youth are afforded the toolkit that they need to reach their full potential. And so what we do, how we do this, is we are aligning with change makers in different states. Our initiative is to serve 6 states, tribes, and territories every year. And that extends for a period, the grant is funded through 5 years. So that'll be 30 states when we complete this. And so our hope really is that as we're developing our TA plans, that those change makers in child serving systems are collaborating with us. And Michelle will talk a little bit later about technical assistance and pull in some key terms around how we bring in these change makers and how we utilize them to help support the change in a particular system. And then we partner to build culturally and linguistically accessible mental health services. So accessibility of service that are uniquely designed to meet the needs of these particular families. So the why of the National Center actually sits on top of another initiative called the National Training Initiative for Mental Health Adoption Competence. And we'll talk a little bit more about that in terms of it is not Case as the lead in this grant is been in the field of creating the terminology and the framework of adoption competence for about 25 years, and most specifically in the last 14 years, creating curriculum to advance the workforce and understanding about what adoption competence can do for states, tribes, and territories. Okay, next slide. All right, and so just spending a minute on this slide, I know most people here very clearly have this information already, but again, it's important to think about kind of the different aspects of this. So when we think about the mental health needs of this population, we think about the incidence rate of how often and a prevalence of need, which is significantly higher than the general population. So again, 3 to 4 times more likely to need mental health services. Of course, they experience much higher rate of various conditions. And so you can see the list there. I won't read it to you. But one of the challenges that has been ongoing is the disproportionate utilization and referral of all populations, to mental health services. And so one thing that we know is that in terms of those who are involved in child welfare, 1 in 9 children, Black children, will spend part of their childhood in foster care, and 1 in 7 Native American children. So that's a significant amount of individuals who are going to need those services. But what's important is if we do this well, right? If we're able to deliver a workforce that can meet the needs of the population, that is well trained, where referrals are appropriately, working, we're going to see families heal. And what's really important about adoption competence is it's all about the future in terms of how do you heal from the experience of being in foster care, being removed from your family, loss, grief, attachment issues, and so forth. We know that when that is well treated, the trajectory looks really different than when it's not. So when it's not, the last point on the slide really is that 60% of this population, they might be 10 right now, but when they go into adulthood, 60% of these individuals will have lifelong disorders. And so it's not just a now phenomena, it's an ongoing phenomena that carries significant impact in people's lives. And so we care about this very, very much because we want to make that trajectory, that number of 60%, as low as it can be. Okay, next slide. So this is a slide and I'm sure most of you are familiar kind of with, the compromised beginnings and the experience of child welfare and looking at adverse childhood experiences. And the point here that I want to make really is that, the impact of this early adversity, right, is something that translates over time in very significant ways. And so by the time we know that the ACEs scores and what has happened as experiences for this population has lasting, impactful, impact on their lives. And so we want to make sure that, again, that we can change this. Again, experiences happen, but how do we respond to those experiences, and how do we provide services that are responsive to those fundamental issues of loss, grief, attachment issues, healing in the context of a relationship with family. And we'll talk about that in terms of our curriculum. Okay, next slide. So just in a nutshell, I want to share what our primary outcomes goals for the National Center are. And the first, as Bonnie said, is increasing collaboration. So one of the things that we want to work very hard in different states to accomplish is to building bridges between systems, and bridges that actually work very well, right? So that we have systems and providers who are collaborating on the well-being of children, and that the issue or the child doesn't rest in either system. It's in both systems. It's an aligned need between child welfare and mental health. So increasing collaboration is significant in terms of goals. The other is the increased use of training. So I think what's important to note here is that, really around the adoption competency, we'll talk about the fact that this training that we are bringing forward in all technical assistance is the use of NTI. And I know some folks may be familiar with NTI, but it is a state-of-the-art curriculum that is free of charge, available online, self-paced, and with the provision of coaching. And so in order to equip the workforce, we want to both train and support shifting in practice. And the third goal is really to improve access to services. And in state to state, what access looks like differs significantly, what the key challenges. In some communities, it might be the challenge is geographic. There are very few services in rural communities. In some areas, it might be that linguistics is a challenge because, the providers are not speaking in that native language. It might be that accessibility is around wait time for services. It might be that there are some providers out there that they may make good referrals, but the barrier is wait time to services. So when we talk about accessibility, we're really having a broad brush on accessibility and the different accessibility features that impact states the most. So those are our three goals, along with sustainability. When we talk about the work that the National Center is doing in different states and across the nation, this is built to be sustainable. And so when we work in states for 12 months, 12 to 18 months, 12 months is intensive TA, the additional 6 months is kind of step down TA, but we're building the program for sustainability. And what we really want to do is make sure that all providers, it's a lofty goal, but we'll say it, all providers who interface with children and youth who have experienced the child welfare system have adequate knowledge, skills, and practice support to affect change. And so in terms of sustainability, this is something that we have seen in different states be integrated into things like onboarding for sustainability, so that they're not catching up the workforce, they're preparing the workforce. So that's one of the issues in terms of our work. And then the very end of the road, we are really hoping that we see enhanced youth outcomes, improving well-being, stability, permanency, and behavioral health outcomes for children. So again, that's our long-term goal, and how we get there we'll describe a little bit further. Okay, slide. Okay, so as I mentioned, this is a little hard to read, but the top boxes are our goals, enhanced collaboration, improved access, and workforce competency. And when we talk about workforce competency, I want to pause on that just for a minute, because this initiative it actually serves three different systems. There's a curriculum that serves the mental health workforce. There is a different curriculum, but aligned curriculum that supports the child welfare workforce. And there's a third curriculum that supports the educational workforce. So once we have in a particular community or system, all of the workforce being trained on a very aligned curriculum, the language, the priorities, the understanding become shared language, shared vision, shared understanding. And so we want to make sure that we are driving, kind of a system level change of professional competency and development. And then the bottom boxes are just kind of showing visually what connects to what. And so in our initiative, we have things that I hope are of interest to everyone on the call, which is we have universal technical assistance. And what that means is we have a knowledge hub. And in that knowledge hub, we have materials, resources, articles, information that is going to be helpful to any child welfare worker, mental health worker, or even families who want to learn more about what is adoption competence, how do I get better services for my family, what does that look like? So that's the technical assistance that is universally provided, and it's free of charge, it's online. And in addition, that's where we house our webinars and our chat conversations and so forth. And then the green box is where Oklahoma is now focusing. And Bonnie, thank you for really supporting our efforts to bring this technical assistance to Oklahoma. And Michelle Savio is leading the initiative overall of all states who are engaged in this. But really, that in-depth technical assistance is designed to meet the priority needs of a particular state, tribe, or territory that may already be in process. And so we're not creating brand new initiatives all the time. Sometimes we're expanding breadth or depth of something that's already occurring. Okay, next slide. And so, in terms of the goals, what our overarching goal is improving the capacity to deliver culturally and accessible mental health services. And so again, those three goals, which we've talked about, how are we going to get there? We're going to do a couple of things that are important to point out. And part of that is the National Center is going to provide a level of expertise that is not easily found elsewhere. And we'll talk a little bit more about our team. But this challenge, improving mental health outcomes for families and youth who've experienced child welfare, is a huge issue in terms of it's a huge need. There's urgency to it. And if it were easy, it would have been solved. So part of our work is to be really creative around how do we move forward that needle by providing the expertise needed to support states to move forward. Our other piece is that this is not a static national center, meaning that we just have information available, but part of our work is to collect stories and experiences to put on our hub so that others can learn what's happening in other states. You can learn, again, it's a push-pull communication vehicle so that we're interested and we hear from, we just did a focus group, for example, at the National Foster Parent Association. And our job there was to really learn from the field about what families need more specifically, and families who are in the process of fostering and adopting youth. And so our website and our knowledge hub will be aligned to meet those needs, dynamic, as opposed to kind of just pushing out of materials. We are valuing the input of states, tribes, and territories in terms of the work they're already doing, and we're featuring that. So, and then again, the third how we'll achieve this is really looking at developing and delivering the tailored on-site technical assistance. Okay. And so I mentioned if this was an easy problem, we would have solved it already. And it's not. This is a really important issue. It's complex. It requires a network of change makers to help support the efforts. And so in our staffing of the National Center, we are partnering with a series of experts across the nation to bring what we believe to be the key leverage points in a system to make these kinds of changes. And so Case as the lead will bring expertise in adoption competency. The Baker Center for Children and Families at Harvard will bring the mental health training and TA expertise. FREDLA, which is Family Run Organization, will bring the perspective of families who have either successfully gotten what they needed, which is wonderful. We'll hear from them. And for those who have not gotten what they needed, we'll hear from them as well to understand more specifically what they need. We'll have lived experience in terms of youth and foster club. NAA is going to be our racial and cultural equity perspective. And NFPA I mentioned is around advocacy and kinship families, adoptive and foster families. And then last is our policy arm and then our evaluation arm. And so what's important around this is that as we learn in each state, tribe, or territory what the primary needs are, we will equip the team with the resources needed specifically for that TA goal. And so, for example, if we are working in, really wanting to bring in family voice and family organizations, our partner at Fredla has both a national perspective and can operate in any state. So they can bring expertise of things that are working in other states and help inform and suggest or maybe brainstorm some ideas in another territory. Next slide. Okay, so this is kind of the heart of what we're talking about, and I want to do a little bit of a language clarification. So we were funded by adoption dollars federally initially, and so the name adoption competence, I want to say, it's important because it really is a framework for understanding, and that's how it's been coined. But we want to make sure that folks understand that adoption competence is a series of skills, knowledge, and practice that can be applied to any child and family in any point in child welfare. It is not specifically adoption. It is all of the families that touch child welfare. And so, again, each state, and I don't know about if we had a chance to talk with you about this yet, but the idea around how do we name this, how do we coin this for sustainability and local uptake that makes sense for the state. We have been given permission to allow states to design a great name and a great logo for that purpose, so that it's owned, really and sustained by the state. So I wanted to clarify that adoption competence to include a much broader audience. And important in the training around adoption competence is that this is not it's not a single practice, but really a comprehensive set of knowledge and understandings that incorporates other evidence-based practices. So it will touch on other evidence-based practices that you're already familiar with, whether it's motivational interviewing or CBT training or trauma-informed care, or there's a bunch of things that you already may be familiar with. And this is to complement, not duplicate, the trainings that you've already had as mental health professionals. So we want to really look at what is the experience and the particular needs of clinicians, what do they have to adequately work with and treat families that are, coming from this population. And so, again, these are just some key features. Much of this is probably familiar in other certain evidence-based practices, but it is, again, attachment focused, trauma informed, very much keys to the concept of healing occurs best in the context of a family. And so we are working with providers to work with families and for families in service of their treatment goals. And then again, what we talked about earlier, the core issues around the experience of being, removed from your biological family or your family of origin has impact on youth. And so those core issues around loss, rejection, guilt, grief are really critical to understand, because they're actually the foundation impact of what happens, then kind of cascades into a number of other issues oftentimes if they're not addressed well. And so understanding this training will help understand these concepts much more deeply as it relates to the experience of being in child welfare. And then there's therapeutic parenting, which is really critical, to really help understand that behaviors, and I'm sure most of you all are kind of practicing in this way. Some of the behaviors that we're seeing, there are deep connections to the loss, rejection, grief, and guilt. And this is the type of experience that travels with you for a lifetime. And so we talk to adoptees, adults who have been in the foster care system. We have folks who do presentations, and they talk about the impact of these experiences over the trajectory of their life. And so it's, again, it's not necessarily now it's an issue and you get treatment and all is well. It may need ongoing support over a lifespan, depending on what's going on in people's lives. And so this is a really, adoption competence is a way of framing and a way of thinking about the issues to help support families most. Okay, next slide. So I'm going to skip this slide. I think in service of time, that's okay. So I want to focus on what's at the core of our work is partnering with youth and families to help transform systems. And what we know is if folks aren't at the table at initiation, if they're not at the center, if we're not listening to them, then the systems are not going to transform as well as they would if we had full input and full co-creation of technical assistance plans and support from anything from how are services working to what feedback do you have if you've been treated by an adoption competent professional, what difference does that make? And so we're continuing to collect information from youth and families to help support getting them closer to a system that is responsive to their needs, both culturally and linguistically, which has, a lot of work under that as well. Okay, next slide. So lived experience. I think, just to focus here again, this is a critical value in the work that we do, is that we value highly lived experience. We have 4 partners, and that is what they bring to this initiative because it is as important as it is. And so we're integrating lived experience into our understanding, our technical assistance plan, our briefs, all of the work that we're doing. And then that input is also strengthening advocacy and policy development, both in states and nationally. And then we're looking at family and caregiver engagement strategies in terms of how do we use lived experience from others to help support that family and caregiver engagement. Okay, and I think the last little square on that is our knowledge hub. So access to knowledge of best practices, because we've learned a lot in this, since inception of NTI adoption competent training in 2014. Over the last 10 years, we have learned a lot about what the field needs, what providers need. And so it's in the knowledge hub, we will gather key information to be able to provide it to any audience. And then again, the audience includes child welfare, mental health, and families, as well as any other change maker, which could be family organization, policy makers, juvenile justice, education. So it's a cross-system initiative. Okay. Next slide. So I won't read the detail on this, but just to talk a little bit about, what's the flow of what we're doing and who are we working with? And so we're bringing to the table systems perspectives, which are held by leadership and systems. We're bringing together community experiences. And so that can be both caregiver experiences and youth experiences. We're bringing together managed care to the table or other insurance carriers for the purpose of looking at, how do we create an incentive type system for appropriate training, appropriate compensation for specific expertise. And in some states, if it's a statewide carve out like it is in Oklahoma, those partners are really critical because they can help support our goal of making sure that our providers are trained as they need to be. Agency and facility, family, child and youth, and we'll share these slides so that you'll have them. But I think that the point is just to say that, we're engaging all of these players for the purpose of creating the outcomes we're looking for. Okay, next slide. Here's a slide really just talking about racial and broader equity. And I think everyone on the call is well aware of the disproportionate outcomes and the disproportionate access to services and to systems. And so what we know is that we are going to have to make very targeted, focused efforts to understand in each state, tribe, or territory what is working and what diversity efforts need to happen. And so we'll be collecting that information. We are sharing it broadly. And for anyone who's not signed up for our newsletter, we will share it at the end. But again, it's a BIPOC month, and we're really looking forward to looking deeply at the issues of disparities. And that is broadly defined. So stay tuned for that. The dissemination process. So we'll be looking at how do we disseminate that information? How do we outreach to those who've historically had systemic racism impacts, and developing partners with associations whose primary purpose across, in every state and across the nation is really to address that disproportionate outcome, and then engaging communities in technical assistance. And so part of that work, Michelle will talk more about in depth about how do we engage communities and how do we work to engage individuals who've been impacted. Because we think about this effort as in terms of, looking at how can NTI equip a system, we think about kind of the 3 areas: the individual themselves, the provider themselves, will gain expertise, skill, knowledge, and have access to incredible resources that they can go back to and revisit. So that's at the individual level. Then at the organizational level, we see that as another impact circle, kind of when we're looking at a diagram. And those organizations who choose to take NTI as an organization, we're looking at that as kind of the next subset of change in terms of organizations who commit to this and who train their staff. There will be impact organizationally, which is different from individuals who may take this training outside of an organizational context and support. And so then the last is obviously the societal impact. And so we believe that that we will have impact individually with providers, in organizations, and then overall throughout society, making this a priority. And again, equipping our families with the knowledge and understanding of what they can advocate for in their systems. Okay. Next slide. I will kick it over to Michelle.
I think I'm unmuted now. So thank you,
Yes.
Mary. I'm Michelle Savio. I'm the Director of Technical Assistance with the National Center. And so I'm going to talk a little bit about what technical assistance means. And with the National Center, we have two types of technical assistance, as Mary indicated. We have our universal technical assistance, which is available to anybody at any time and is really going to provide a great depth of information about mental health services for children, families, and children, youth, and families involved in child welfare. And honestly, I believe children that have experienced loss can benefit in many ways from it. So we are, have that universal hub, really, want to connect people with others across the nation and really create a network of professionals that can benefit from that knowledge. And then we also have intensive technical assistance, which we will provide to 6 sites, 6 states, territories, or tribes every year. And so what technical assistance really is a change initiative. Our work is to take all the knowledge and transfer it from experts and share it with the field and make sure that everyone benefits from that knowledge. We want to support you all as you do your work with children and families, and really give you the knowledge and tools to really make you feel more confident in when you are working with them. We will be using NTI as one of our tools of technical assistance and really working to increase the knowledge of that through that robust training, which is a really state-of-the-art to provide information to mental health professionals, child welfare professionals, and even educators to help improve the work with these children and families. So our universal technical assistance is, we have our website, it's up and running. It's on that you will learn about all of our partners. You'll learn more about what technical assistance is. There'll be articles on there. If you're looking for information about a specific topic or a specific resource, we hope that you will access the Knowledge Hub. We also have a chat function on that website. So if you're looking for something and perhaps you don't see it, you can chat with us at any given time, and we can do some research. We can do some of the legwork for you through the Knowledge Hub and help get you the information. Maybe it's there and you can't find it, or maybe we can do a little bit more digging to help you get what you need. But we also have a blog and encourage you to sign up for our monthly newsletter. Because that will give you a lot of good information as well. And so this is constantly growing and evolving. And the goal is that it's going to meet the needs and be your go-to place for information and resources in your work. As you go into it, as I said, the go-to repository, we want this to be that your source of information when you're looking for evidence-based interventions, you're looking for models and treatment mechanisms to work with these children and families. As I indicated, it's for child welfare, it's for mental health, but it's also for the families. It's also for families that may have adopted, maybe it's foster families or biological families who are looking for resources on how to better parent the children that they're with, manage some of the behaviors that they may encounter as a result of their involvement with child welfare services, and the general public, so anybody can access it. We're taking all of the information that we gain from the focus groups that Mary talked about, what we learned from our intensive TA sites and conferences, and what we're learning from our family voice organizations, inputting all of that information into the Knowledge Hub so that we can create the webinars, podcasts, blog codes. We want to have a place for peer-to-peer learning where sites can learn from one another. And even if sites aren't engaged in intensive technical assistance, that states, territories, and tribes can go to these and hear from others on what's working and what's not working, and really have the capacity to learn from and brainstorm with one another. You will find toolkits there as well as e-news. And so it really, as it continues to develop, it will continue to get more and more information and really be your go-to place for information. So intensive technical assistance is our tier 2, and we have already engaged with Oklahoma, and so we are going to be working with Oklahoma. We had a kickoff back in May and are in the process of beginning the development of the work plan. And technical assistance is simply a change initiative. And so we are using implementation science to bring in tools and resources to help move forward that change. And then our roadmap is going to be that work plan. And that work plan is co-created by the individuals in Oklahoma, as well as the National Center partners, so that we can use our knowledge together to really develop a plan that's going to meet the needs of Oklahoma, meet the needs of the children and family, and achieve those goals that Mary talked about, of really building collaborations between mental health and child welfare, bringing in training that can help enhance the workforce and as you work with these children, and really so that you can develop the confidences that you need and have the tools that you need. And then improving access is our third goal. So we're going to be doing that as we develop that work plan. And so what's next is the work plan development, and then we will also be having some additional on-site sessions, as we move forward with our technical assistance. And I'm hearing from a meeting yesterday that the next one will likely be in the fall of this year. And so, having that to move forward with really implementing that work plan and having some groups. So I'll talk a little bit about steering and implementation groups too as we move forward. But first of all, what is technical assistance? As I indicated, it's based on implementation science, and it really is simply a set of tools and activities that are designed to bring about change and sustain that change. And so as we think about that, we want to think is, what is the thing we need, as a particular thing, what is it that we need to implement? For instance, say the thing is NTI, the National Adoption Competency Training. We want to make sure that that is spread far and wide across Oklahoma so that people have knowledge and of it. They're able to easily access it. They're able to get it, and it's really going to benefit their practices. And so maybe that's our thing as NTI. So then we'll look in, excuse me, then we'll begin to look at what resources do we need to implement that thing. And so, we'll be working with people, all the partners in Oklahoma to say, what kind of resources do we need to bring in? Maybe it has something to do with the managed care organizations. Maybe it has something to do with licensing and getting CEUs, because it does offer CEUs. And so we want to work on what needs to what needs to be put, what resources do we need. And then we're going to begin to develop that plan and have the processes in place so that we can begin to implement those changes and move it forward. And so this is kind of a layout of the science of technical assistance. And so to break it down, we're going to be looking at the innovations. And so the innovations are the things that I just talked about. It might be the NTI. It might be what do we need to do to improve access. So those are our things. And then we're going to be looking at our stages. And so breaking it down into manageable parts to make it easier to implement and more feasible to implement, because we know that everybody is already very busy in the work you do. So we want to make sure that we're doing this in the right stages. And then we'll bring in the drivers, and those are those resources that can help implement change, and teams. So I'm going to talk to you a little bit about steering teams and implementation teams that we will be developing to help move those forward, and then looking at those improvement cycles and making sure that when our initial plan isn't working, that we're making the adjustments that we need, um, and recognizing that we need to make some changes within the plan to make sure that our plan is effective. And so constantly looking at that and circling back and making those adjustments. So as we think about who needs to be involved in technical assistance, you can see from this chart, if you can see it well, it's quite expansive, which means anybody involved that may be impacted by child welfare would might want to have some kind of involvement. So we have, the systems of child welfare and mental health, but we also have partners, we have providers, we have schools, we have training partners, we have fiscal and juvenile justice. And this list is probably not all inclusive, but it really is who we put down on paper first to give us some things to think about, definitely systems of care, partners, networks, university affiliations, even medical. There's a role at the table for all of these, because everyone can contribute and help drive and move this process forward. So I thought that was it. I'm sorry, I talked to you about teams and steering teams, and I thought there was a slide, but I see that there's not. So as we move forward, one of the things that we're going to want to do in Oklahoma is have steering teams and implementation teams. And so steering teams, what they're kind of the drivers of the plan. They are generally in leadership type positions, or champions of the initiative that can help drive it and move everything forward. All of the plans or all of the teams that we will look to develop, we want to be inclusive of diversity and inclusive of different roles and different organizations, so that they are diverse and can help drive the plan. And from there, we'll also be looking at implementation teams. And the implementation teams are really the kind of that carry out the plan in many situations. And they're going to be looking at um, the plan objectives, and we're going to be working with those to develop strategies and tactics to achieve those. And so the intent is that we'll be working with those teams on a regular basis to move the technical assistance plan forward. And we believe that through those teams and through these regular meetings and through our 4 on-site work events with you, that we'll be able to achieve the outcomes that are hoped for, and that the state of Oklahoma is seeking to achieve. So that brings us to our Q&A, and would definitely want to open it up to everyone to ask any questions that you have, or share any thoughts that you might have without it. And I would also like to use this kind of as a call for your participation and for you to think about how you might like to participate in this initiative. That might be as simple as saying, you know what, I want to take NTI and get out there and get in front of it. Or it may be that you'd like to participate in some of the other planning and mechanisms, and we would welcome that. So definitely would like to open it up and hear your thoughts and questions.
I see someone in chat already. Sharita has already expressed interest in being involved. So what would be the best way? Who would be the contact person for any interest of any participant?
Yeah, so I think the best way to do that is Joanna Maranta is our implementation specialist that will be working with Oklahoma. And I can definitely put her information in the chat, but we can also include it with maybe I would just add, maybe I can just add it to the slide and indicate that if anybody who's interested could send a quick email to her. Unless I would, Bonnie, unless I would, since you're involved with, do you have a different recommendation you want to go through, Johanna?
No, I think that's a great idea. I know that we're looking at doing a kind of a follow-up to the kickoff and having anybody who's interested in joining the steering or implementation committees. We're going to have a kind of general gathering to overview all of that again and have final commitments and make sure everyone knows what they're committing to. So now would be the time. Now would be the time to definitely reach out and let Joanna know. Also, Sharita, you mentioned something that is dear to my heart, so I just wanted to call it out. You said would also suggest we reach out to adults who are adopted as children. Totally agree, and definitely a part of what we are planning, and a lot of the population that I speak to the most. So definitely agree with that, and we'll incorporate feedback and perspective there as well.
Mm.
Yay. Yay, Christy, starting the training as a child welfare worker, the NTI training, and plan to get back into it as a mental health professional now. Of course you will, Christy. You're awesome. She's a rock star. Excellent. Oh, Mary, you asked Christy to share experience with NTI. Great idea. Christy, would you be willing to share more thoughts about what your experience with NTI has been?
Sure. So it's been a while. I will admit that I didn't get to finish my training. Definitely got kind of sidetracked as I was finishing up school last year and everything. But as far as getting enrolled and everything, super simple, easy to kind of figure out like where you fall in terms of accessing the free training. Layout is super easy to follow as you're going through the training. I love that there's the constant reminders through email, like you have so many days to finish it. But just the training material itself, it is just, there is so much. And it's just amazing to me that that is all free. It really did help inform what I did when I was working at DHS, and even now, as a new therapist, I definitely hold what I did learn in mind. Just a little bit of training and then, practicum experience with Bonnie and everything. It's such a great tool. So I encourage everyone who, hasn't heard of it or maybe is just kind of interested in it to definitely get yourself signed up.
Thank you, Christy.
Yes.
Christy was one of our... Sorry, Michelle.
Go ahead. No, go ahead. Finish your thought.
Yeah, Christy was one of our post-adoption practicum students when we first started adding quite a bit of post-adop support and services across the state. So Christy was right in there being a part of the brainstorming and growth of everything that we're doing in Oklahoma. So thank you so much for that. Also, Sierra put a link in chat to access NTI. And I also want to offer, Sierra is the clinical program manager here at the Center for Adoption and Family Wellbeing at OU. She and I are in this center and we run coaching sessions with NTI. So if you want to join a group of other professionals who are going through the training together and meeting about once a month, we meet virtually for about an hour and just talk and consult and process the content of NTI together. So I'm going to go ahead. Looks like in the chat, Mary put Joanna's email. That's Maranta at adoptionsupport.org. So if you're interested in joining efforts about the National Center, everything that's been talked about today, email her. And I'm going to put my email address in the chat as well. So if you're interested in doing, putting together a cohort for NTI coaching, please email me and let me know if you would like to do that together. NTI stands for the National Training in Adoption Competent Mental Health Initiative. Did I say that right, guys?
Mhm.
So it was a federal effort about 8 years ago, something like that. Put together this really well done, easy to access, like Christy said, online training. But we like to put cohorts together to be able to do the online training, but then process it together as well.
Mhm. I see, I do see that quite a few people have expressed interest, and that's exciting to see. So, please do email Joanna. I don't know if so you have her email, because I don't know if we'll be able to get all of your contact information through the chat to be able to reach out to you. Is that possible to do that? Or just to have people email Joanna is better?
Yeah, I think it'd be good if you are interested to go ahead and shoot that quick message to Joanna, because we've got quite a few people on here today, so that'd be great.
Yeah, and we are working to schedule kind of a relaunch information type session, hopefully yet this month in July. We'd like to get it, soon after the holidays, so that we can move forward with beginning technical assistance. So I'm gonna let her know that she should expect some emails to come through, so that we can make sure that you're invited to that session, where we'll be able to provide some more detailed information about what it means to sign up for teams, and meet our technical assistance team, and so that we can be able to get moving forward with you.
I think it's also a good idea to let you all know the end of this month, July, is it 30th, Sierra? July 30th, our next Lunch and Learn. We will have Dawn Wilson and Leslie Wright with Case. Leslie does the TAC training, which is in-person, more in-depth training on adoption competency that we do have available in Oklahoma. And NTI is this online training that we're talking about. They will both be on that presentation. So if you're interested in learning more information about those trainings and have the opportunity to ask them questions, hop on with us again on July 30th for our Lunch and Learn on that day.
Great. I was going to tag Bonnie to your a lot of coaching kind of chats in here, and I wanted, for those who are child welfare professionals, I just wanted to point out the NTI curriculum does have a specific layer on top for supervisors, and the intent of that is to help support supervisors to support their staff. So, again, we're really working at trying to support practice change, which, again, we think of what we're offering and what we're doing as much more than a training. We think of it really as developing the workforce and a professional development effort that will involve multiple things over time. And so, as Bonnie said, we really hope that folks who are, big proponents of NTI will then look at TAC as a possibility for deepening and broadening their clinical skills in Oklahoma, because you do have that available there.
Yeah. And I want to show, when we do send this PowerPoint, you'll have a link right here also to access the NTI training, if you would like to get that started and begin that. And it does come with free CEUs, for those of you, if we didn't mention that. It does have, CEUs that you can earn at no cost to you, which is always, to me, I always thought that was a huge bonus.
And one thing that we are doing as we go along is really trying to understand kind of the level of awareness around adoption competence. And so that we can kind of have a baseline understanding of who is actually familiar with that concept or familiar, has taken a training. So just on this screen, I was just wondering, I did see someone, a couple of people who had taken NTI. Are people, maybe just a shake of the head or a chat, asking the question around whether adoption competence is a familiar concept to those on this call, or is it a new concept? So would love to hear, familiar, not familiar.
Definitely familiar.
Thank you, Melanie. Okay, anybody else?
I am also kind of familiar just by being an adoptee myself, but I also just started a new job about 4 months ago within the behavioral health field. So
Thank you. That's good to know. Thank you. And a couple folks are familiar but missing key pieces. Some people are interested in learning more. So it sounds like we have people who've taken the training, who are familiar, and people who need to have more information. So we've got the entire spectrum of awareness here, which is great. So I think there was a response, and maybe everyone saw it. So a couple of questions around, will I have access to the PowerPoint? There was a chat that was, put in the chat around materials and resources will be available on the resource database. So I just wanted to point that out because I know some folks asked, can we send the slides? So it will be available there, correct? Yeah. Okay, great. And we invite you, part of our work, again, is really ear to the ground listening for what providers need, for what child welfare workforce needs, what systems need. So if you're not able to participate formally as a steering committee member or an implementation member, but you want to share your thoughts, please also reach out to us for that purpose. Again, your commitment can be simply sharing your experiences or sharing what you believe is needed. We will welcome any of that participation. And then more formally, as you move up kind of the engagement process or level, you'll have opportunities for being part of either the steering committee or the implementation committee. So again, we hope this is not a single conversation, but we hope you've opened the door at any point to reach out to any of the National Center staff for more information or for how we can better support your needs and the work that you're doing. And again, as Michelle mentioned, we're here to provide technical assistance and support to anyone who it may be informational needs or it may be system change efforts. So feel free to reach out at any time. Any other questions or thoughts? I mean, I really appreciate some folks putting in the chat that they believe that this is a critical initiative, that it's an important initiative, that they're excited about it. That's really great to hear the echoes of what we've been hearing, all along in terms of the need for this and the appetite for it and the benefit to it. I'll just share very quickly that we did a presentation where Bonnie was able to bring some family members and some others to talk about their experiences and also to talk about, we've tried to highlight the difference for families about what it means to be provided treatment.
Pizza is here.
From a professional who is adoption competency trained. And we have kind of resounding information that the difference it makes is really significant to the families that are being served, particularly in mental health services. So, okay.
All right, Mary, Michelle, thank you so much. I really appreciate your time and your expertise and your willingness to partner with us here in Oklahoma. I'm really excited about the things that we've got going. And it sounds like we've got some great people who are interested in joining us. So thank you all for hopping on here. Reach out, let us know. We are absolutely interested in having further conversation in all these different spaces. So thank you so much, and hopefully we'll see you again on July 30th.
Thank you.
Thank you.